human immunologist, Derya Unutmaz, in Farmington, Connecticut. Derya, thanks so much for your time for us. What do you make of this latest development? Is he ready to go back to work just 10 days after the diagnosis?
Yeah, so his situation is, I mean, there are several things to consider. Number one is quite unique because he was given a set of drugs that are, a combination of which hasn't been used to my knowledge. He was giving antibodies that actually suppresses the virus for a while, but we don't know if the virus will come back. He was also given as a treatment a powerful immune suppressor called dexamethasone, which was unusual because this drug is given at the late stage of the disease when it's very severe, because the problem is that the immune system causes a lot of the symptoms, so you want to be able to control it. It's not the virus anymore. According to his doctor, his symptoms started Thursday, so that would actually make it 10 days according to CDC guidelines by Sunday, to my calculation. So the earliest time point he could get back to, being considered being virus-free or symptom-free would be Sunday, and that is for mild to moderate cases. But Trump's condition could also be considered severe because he was hospitalized for 2 days. Apparently, his oxygen levels decreased. And right now, because he was on this dexamethasone immune suppressing drug, the virus can actually come back and it can start to replicate. And you wouldn't really know that by doing a test either, because the test can give false positive, false in the sense that you detect the pieces of the virus, but they may not necessarily be replication competent, what we call, or live viruses. So it's a very complicated situation. If I was his doctor, I would not recommend him going back to work or to public by Saturday.
Right, and there just quickly, I mean, as you said, it can happen. The virus can come back, even if he tests negative. He's supposed to get another test on Friday. But how do you protect other people if he goes back rallying?
Yeah, that's a major concern. And again, the next 2 days will be critical because in some patients who are given these drugs, they can feel great, a lot of energy. Dexamethasone has that kind of side effect, so Trump might feel that he's ready to go out. But it's unclear both for his own health as well as you pointed out, that there might still be infectious virus that he could continue to spread, because it has been found that up to 20 days, some individuals can produce viral particles that could be infectious. And I think furthermore, what's really even more important, that he should caution on the side of, or he should err in the side of a potential being infectious, because he's the president of the United States. He should be an example. People seeing him in this condition might think that it's not necessary to self-isolate for longer periods of time. So it's very concerning.
Okay, Derya Unutmaz, thanks so much. I appreciate your insight for us here at TRT World.